So you want to do testicle enhancement, but you want to go big. I mean, really big, like bigger than what's found in nature. And in this video, we're going to talk about how this might be possible. In my practice, we place testicle implants as a way to enlarge the testicles. So usually we're leaving the patient's own testicles alone, and they're going to hide behind the bigger implants. So when you look at the scrotum, it looks like you have a two-pack, but if we ever need to check on the native testicles, we're able to reach them. And so this is my preferred way of doing it. Now, it is possible to design a larger custom set of implants. There's 5 off-the-shelf types of implants, which are kind of what are found in nature, going a little bit bigger than that. The largest is 5 by 4 centimeters, but it is possible to really customize your implants and design exactly the size you want. The limiting factor is, of course, whether there is a home for these testicles. And if your testicles are quite small to begin with, there may not be a lot of scrotal skin down there or a lot of room to put these testicles in. And if that's the case, you could come up against the rare complication of what we call extrusion, when basically there's just not enough room in there, so you're more susceptible to infection or losing the implant itself. So in this video, we're going to talk about some ways we tackle that. Typically, just from a logistical point of view, because most of my patients fly in, we usually agree, if we're doing the custom set of implants, and that once we're doing the surgery, and if we find that they are too big, we're not able to comfortably accommodate them, I can have the largest off-the-shelf available testicle implants there. Touch wood, I've never had to do this, but it is possible, and it's nice to have that fallback. The idea would be that it is possible to stage the implants. So meaning that if we put a large size in to begin with, such as the largest off-the-shelf ones, which are the 4 by 5 centimeter testicles, there will be space made so that in the future it's more likely that we can stretch up to a bigger size because we've already stretched things out. 2 other things we can do to help with this process, or to help with the chances of fitting the larger implants, is 1, scrotal massage and stretching. And so this is going to be a very slow process, but it is possible by putting that stretch on the scrotum that with time those little cells will actually grow. It's called mechanical creep and biological creep, and it is the process by which, for example, if you gauge your ears, the tissue will actually grow. So in this way, similar to gauging the ears and putting a stretch on the tissue gradually over time, it is possible to make a difference. Now, over time, I mean, it's usually at least 6 months before you would notice any significant difference. So this takes a lot of time and a lot of dedication on behalf of the patient, but I have to say, in the past, I have seen it make a difference. The next way that we can relax the scrotum is with Botox. And so typically when I do Scrotox, let's say in somebody who's not getting testicle implants, we put it in the cord that connects the testicle to the body. So in that way, if the patient desires, the testicles can hang a little bit lower. But instead, in this situation, we're more focused on the scrotum itself. The position of the natural testicles aren't going to make a difference because our implants are going to be up front, and that's what we're going to be focused on. So we need to make more of a home for the implants by relaxing the scrotal skin. The scrotal skin has a muscle in it that causes tightness, and if we inject it with Botox over the course of about 3 days after this, we can see some relaxation of the scrotum itself. Unfortunately, this is temporary. Ideally, we want to do it before the implants, but this can help. It can also help because we typically talk about after surgery, we get a high and tight feeling as the scrotum gets used to the new implants. So of course, if we've done Botox beforehand or even at the time of surgery, that does help with this phenomenon as well. In this way, for a lot of folks, it may be possible to go very large with your testicle implants.